Hello, in this video let's look at this ANOVATE cream. This is anti-hemorrhoidal cream. Okay, that means for piles, right? Also called as piles, anti-hemorrhoidal cream. So anti-piles cream you can say, and this comes with a potent steroid, that is beclomethasone dipropionate. Okay, so this is having steroid. What else does it have? So it has beclomethasone dipropionate, which is a potent steroid. What and all is it going to do? Steroid, so it's going to reduce inflammation. Phenylephrine, so kind of it's going to decongest, right? Lignocaine, local anesthetic, reduces pain. Okay, and the cost you can see here is pretty expensive. And let's look at the cream. So this is the box, right? And this is the cream inside. Anti-hemorrhoidal cream with beclomethasone dipropionate, 20 grams totally in this. And you have to use the cap to pierce the tagger. So let's look at it. So the cap has this thing which you put it reverse, and once you poke it, it will open. So the cap has run away for the moment. I'm putting the cream here for you to see. So this has steroid, local anesthetic, should help in piles. It also comes with this pamphlet. Okay, we'll look at this, and it will also come with this kind of applicator for internal application. Looks like the cap for that. So now let us first understand what we are talking about. We are talking about hemorrhoids, which we have already studied in surgery, isn't it? So you have hemorrhoids here. So you have internal hemorrhoids they're showing here, but it can be internal or external. So here you can see the external hemorrhoid. This is an internal hemorrhoid. These are veins, if I'm not wrong. So because of multiple reasons, that you're strained during passing feces, or if you're standing very long, that the veins are getting pulled down, right? The blood. So multiple reasons can cause this, and so the normal operative treatment is diet, right? And you should also lose weight, they are saying, if you are overweight. And then you have some injections that they can give, some band application, some operative treatment, hemorrhoidectomy, etc. We are not going into all this here. We are to discuss this cream which will provide some pain relief for the classification ones. Beclomethasone dipropionate, where does it come? So here you can see under steroids, you have topical steroids. In that potent steroids, you have the first thing here, beclomethasone dipropionate. This is the percentage which defines its potency, right? So what is the next thing? Phenylephrine. So where is phenylephrine here in the classification? Adrenergic drug, sympathomimetic, nasal decongestant, phenylephrine. Okay, so we're done with another drug here. The third one is lignocaine hydrochloride, guys. So let's go to this. Lignocaine hydrochloride. So in local anesthetics, you can see here lidocaine, lignocaine, intermediate potency and duration, lidocaine, lignocaine. Okay, so this is a local anesthetic. Okay, so let's get back here, guys. So what is the fourth one here? This is some preservative, so we are not going into that. Okay, we are looking only at the pharmacology. So what does beclomethasone dipropionate do? It's a steroid, so it will help in inflammation, right? Reducing inflammation. What does phenylephrine do? Again, a nasal decongestant, so here it will do decongestion, let us say. Okay, then lignocaine is a anesthetic, so it will reduce pain. or any sensation there. Okay, which is but intermediate kind of a thing, not very long duration. So what are they saying? It has anti-inflammatory property of the steroid, corticosteroid, the analgesic effect of lignocaine, that means pain relief effect of lignocaine, and the vasoconstrictor effect of phenylephrine hydrochloride. Okay, so that's a good thing for you. Indication, this is indicated for pain and for bleeding associated with anal fissures. How will it reduce the bleeding? Because it is trying to vasoconstrict. Very good. With anal fissures and internal or external hemorrhoids. Now what is fissure then? Because we covered hemorrhoid, but what is fissure? So here you can see fissure means it's a small tear in the skin itself. Okay, that is a fissure. So here also you can apply. That's what they are saying. Okay, for that condition also you can apply. Now, post the surgery if you have pain. So if you've got the surgery already done and post that also if you have pain, you can apply this. Minor degrees of proctitis. Proctitis is actually the inflammation of the rectum lining, the lower part of larger intestine, which in images they're showing. Let's see the images. Oh, this is a good image, right? Proctitis. I didn't know what proctitis is. First time I'm hearing this word. Okay, so if there's a minor degree of that, you can apply also, right? But you'll have to go a little internally and apply, I'm thinking. For which obviously they have given this thing, right? Now apply a small amount of cream 2 or 3 times a day initially using the applicator if internal administration is required. When inflammation is subsiding, then you can apply once daily is sufficient, okay? 1 tube should provide treatment for at least a week. Okay, so this much for 1 week, 20 gram, right? For 1 week. Okay, let's move on. Who should not take contraindications? The steroids should not be used in presence of infection, obviously. Yeah, unless effective chemotherapy, that means antibiotic therapy is also employed, okay? Or any other what do you call that? Yeah, so chemotherapy they are saying, so that the infection subsides, then only you can apply this test. They are saying hypersensitivity to any component, if it is there, then don't apply. So if you are applying this and it's becoming worse and there is something happening, then don't apply. That's what they are saying. It's contraindicated if you are sensitive to any of the ingredient inside it. Next, precaution. It is should not be used extensively in pregnancy. We'll directly go to that line. It should not be used extensively in pregnancy. Large amount for prolonged periods you should not apply. That's what the company says, because it can cause some fetal issues. Okay, side effects. It's not there anything that much. Okay, but because applying too much, it can get absorbed into the system. Though you are topically applying, because it's mucous membrane kind of a thing, they are saying there can be, if you apply too much for too much time, it can get systemically absorbed and cause consequences there. Okay. It also may cause changes in the skin. Atrophic means it's going to reduce in size or something, right? Atrophic changes in skin it can cause. So keep in a cool place. Do not freeze. Keep away from children. Yeah, especially if you're keeping in the bathroom. Be careful. Don't keep it next to toothpaste. They'll think it's toothpaste and use off sometimes. Okay. So now this is a 20-gram tube with nozzle which they have provided. Yes. For patients, they are giving this information. It seems directions for use. So you can apply it directly if it is external hemorrhoid. If it is internal, you have to use the applicator. So first of all, how to puncture it and make the opening. I told you, use the cap and reversely, and you will have that plunger in it. So you open it, then you put this applicator to this tube, okay, in clockwise direction, and then you have to stand with one leg raised on a chair or lie down to left side. Be careful, don't fall off, people. And then put it in like this and gently insert the applicator attached with tube to into the anus. Okay. prior to insertion, if you have lubricated it, it is little better, it seems, to for it. So you can lubricate with the same little cream, I'm thinking. Then you squeeze the tube for the required amount, and then you slowly remove the tube with applicator. Okay, and then you wash it thoroughly with soap, warm water, and replace the cap. And don't share this with anybody, because it is a very private personal product. And once you use also, you should be very taking care of hygiene a lot. So we have covered in this video this ANOVATE cream, whose box is here, okay, and whose applicator is here, and it applicator's cap is here, okay, and the cap of this entire tube along with that plunger inside it to make hole is there here. Okay, that's all for now. Bye guys, bye bye.